Awesome. Well, we're so excited to welcome everyone to a info session, an opportunity for conversation around the social impact work and team here at Berkeley Public Health. And just to give us a sense of who's in the virtual room, if everyone could just while we talk, say your name, where you're coming from, and anything that's on your mind right now, and we'll follow along with each other on the chat. But since we want to leave plenty of time for Q&A and discussion, I'll just jump right in and we'll probably have people joining us as we go. Next slide, please. So I think we're all in public health because we want to make an impact on health and the world. And I think more than maybe any other thing you could study, it's about creating the conditions, not just curing people one by one, but really creating the environmental, the population, the family level conditions for health and thriving. And while the life expectancy has done a little bit better lately, we are running last in place among developed nations in terms of the amount of money we spend on healthcare and also in terms of not optimal outcomes. So we have our work cut out for us. Next page, please. And Berkeley is an amazing place for startups and founders, and those include public health startups and founders. But also, we want to bring that engine, that energy of innovation, breakthrough thinking, ability to get going and build things and have some sense of urgency to the work we're doing in public health. So, really bringing the purpose and the mission that we all bring to the agenda, along with opportunities to really, for all of you to be builders and innovators, not just while you're at the School of Public Health, but really beyond that. So we want to have a campus that is an engine of innovation and impactful change where you are the ones really leading the charge. Next slide, please. So what we're going to be doing as a team, and we'll introduce ourselves, I realize I failed to do that as we go, is to go through some of those critical opportunities that you'll have on the Berkeley campus. So I'm going to start with one of them, and then I'll turn to my colleague Kelly Horan and my other colleague Fred, and we'll each be sharing about some of those opportunities. And then we'll be hearing from some students around their experience, both working with our team and working with our team. One of the areas of opportunity for students is really collaborating not just with each other, but across the whole campus to tackle important innovation opportunities and challenges that exist in our environment. So last year we hosted a Medicaid innovation competition. We had $6,000 of cash prizes. We had amazing judges, including the head of Medicaid in California, and lots of students participating across the campus. This year, you are very lucky for those attending Spring Visit Day. We're doing a rural health hackathon where the final pitch event will actually be on Spring Visit Day from 4 to 6:30. And we're inviting anyone who wants to, who's visiting campus that day, to attend that event. The QR code is right there on the screen, and we'll share these slides afterwards as well. Please sign up, come join us. We have 150 students from all over campus who will be participating. And I think it'll give you a great sense, not just of our team, but also of the broader innovation ecosystem that you'll be able to enjoy and be part of on campus. And just by way of backwards introduction, my name is Claudia Williams, and I am the Chief Social Impact Officer at the School of Public Health. So I'll pass it off to my colleague, Kelly.
Yeah, thanks so much, Claudia. I'm Kelly Horan. I manage social impact innovation programs here at the School of Public Health. I'm also a really proud alumni of the MPH program. I had an absolutely amazing experience in the program, but I also was really seeking out more hands-on experiential learning opportunities to apply what I was learning in the coursework, which is why I feel like I have the best job in the world, which is bringing you guys the programs that I really wanted when I was in the MPH. And so a few of those I'm going to be speaking about today. The first is Social Impact Tuesdays. which is a 1 unit group study course that I, along with my colleagues on the social impact team, lead in the fall. And we bring in really amazing guest speakers that are actually out in the field of public health, doing work within the community, working with community organizations to improve health. And it focuses also on kind of more innovation strategies and design thinking. And then as you're working through the course, you'll actually develop a proposal of your own creation for a public health initiative. And I'm very excited that instead of that initiative just sitting there, you can actually then apply for funding through our Impact Innovators program, where you can apply for up to $10,000 in funding to design, scale, and launch sustainable community health solutions, working with community partners specifically. It's all student-led. You're working in teams of students. So Social Impact Tuesdays is really the precursor to this program, runs through the fall. You're going to meet other students in that course where you could create a team to work on this solution. You're going to learn about kind of co-designing this solution with community partners. We're very clear that these initiatives are not going to be drop-in, drop-out initiatives. These are things that are going to be sustainable. We're also very clear that this is not us as MPH students saying we have all the answers. These are things you're going to be co-designing with your community partners. But we're really excited to be able to offer that $10,000 in funding to turn these ideas into impact. So if you're interested, we'll send more information about the Social Impact Tuesdays course, how to register for that 1 unit in the fall. It's also a really nice addition to your coursework because it's 1 unit. There's no tests, there's no assignments. You just show up and participate, interact with speakers. And then I think it's a really wonderful networking opportunity for meeting other folks in the MPH. You can also, it's open across campus too, as is the Impact Innovators program. So we love to see teams that are a public health student and a law school student or Goldman School public policy student, engineering student. We get pretty good reach of the program these days. This is the third year we've run, or we're actually in our third year of the program right now. So we've had 25 teams go through this program. They've done absolutely amazing work. I truly have just been so astounded at what they've been able to accomplish. We also acknowledge that you're going to be doing this work on top of, coursework and many other things you have going on, but the teams truly have been able, even with the limited bandwidth and a relatively limited budget of $10,000, have been able to do just absolutely incredible things in the program. So just to give you an idea of like what kinds of things we're funding, what kinds of things students are doing, this is our third cohort. This is our biggest cohort yet. It's 10 teams. We've had a cohort of 7 teams, a cohort of 8 teams come through the program. And I know you may be thinking like, oh, is this program super, super competitive? Is there no chance we'll get this $10,000? It is competitive, but I'd say each year we generally fund about half of the applicants. So it's competitive, but it's not impossible to get the funding. And so in our third cohort, for example, we have Unmute Health, which is building a digital health navigator to reduce diagnostic delays for women with chronic pelvic pain. We have Bridge to Care, who's improving access to healthcare services for unhoused individuals in the East Bay. Collective Breath is engaging youth citizen scientists to monitor and improve air quality across the Bay Area. They're actually going to be installing air quality sensors at Bay Area high schools and working with the youth there to collect that data. Here is improving auditory safety in public places for people with hearing loss. And then Rubric is building social infrastructure in rural areas of California lacking public gathering spaces. And this is actually from one of our online students who is himself located in a rural area of California. And he's going to be joining us for our student panel shortly. So with that, I'm going to turn it over to Fred to speak to you all a bit more about our Impact Fellows program. And we will have time at the end for questions as well. Thanks all.
Hi, everyone. My name is Fred Dillon. I'm Director of Strategy and Partnerships for the Social Impact team at the School of Public Health, and really delighted to speak with you all and excited to connect you with some of the great programs we have. And one of the key programs I run is our Impact Fellowship. And this is a fellowship where we bring in seasoned, experienced visionaries, change makers in the healthcare in the health arena broadly, who have really done great work and are looking to take on a new project that they really care about, something that they've been itching to kind of work on, and they come into the school and connect with our faculty and with our students. And in many cases, these impact fellows are interested in working with a group of students to help advance whatever their project might be. And just as a couple of examples, I won't go through everybody's on this list. You can go on to our website and find all of this and find out who these amazing people are. But one really current example, Rishi Manchanda, who's sort of in the on the left-hand side of the screen, the second person to the right on the bottom, he recently did a really big convening on how to expand capital to support amazing health equity projects across the system, and how do we really unlock that capital through really key funding mechanisms and collaborative funding mechanisms and new ways of modeling impact. And so we had a group of students. We had one coordinator student and then three lead students who actually helped organize the actual work groups and bring together. And then we're able to speak to what the work groups did at the end of the session in front of 60 leaders in the field, which was really exciting and amazing. Just as another example, on the far right of the screen, at the top, Matt Willis is a former head of public health for Marin County here in California. And he is now doing something called Your Local Epidemiologist California, which is an amazing resource, and where he puts out what's sort of emerging in public health in California. And we've been able to have students work with him on actual stories for that newsletter that goes out. So there's a group of, I think, 6 or 7 students that are working with him on that. So those are some examples. One more I'll give, second to the right at the top, second to the left. So Nikita Singareddy is our fellow who's working on the Rural Health Hackathon. So she runs a Medicaid innovation startup and does amazing work, and she has been a big part of the hackathon. So that's, if you're interested in any of this, we'll have intro events in the fall where all the new class of Impact Fellows will come, and you'll get a chance to meet them and hear about their projects there and see how you can plug in. Next slide. We also do a lot of learning training on the ground. And so just recently, we took a group of students up to Sacramento to meet with policy and stakeholders on rural healthcare, where there are really big disparities and inequities, and how can we really improve the health of the communities in our rural populations. We do site visits, career panels, field trips, to really broaden the student networks and deepen your understanding and really bridge what you're learning theoretically in class to the real world. How do we take everything you're learning and apply it, and what in the real world gets in the way? How can you make change in your own communities? And that's a big part of what we do on the learning on the ground area. I can keep going if you want. This is our social impact team as a whole. You have met 3 of us, myself, Kelly, and Claudia. We also have Liam Chavez, who is our program operations manager and does a lot of in the background, all the things that help our team function and move forward and get our events, et cetera, going. And we also have student associates who work with us. So you'll definitely be hearing from us via email about opportunities to apply to be a student associate. And our associates have been incredible students and really have helped make all of this work happen, and have gotten great exposure to, for example, to our impact fellows as part of that experience. So that's a little about the team. I don't know if there's another slide. Okay, there we go. I'll pass it back to Kelly.
Yeah, so obviously you've been hearing from all of us about our programming, but we thought it might be even more powerful to hear from students, actual MPH students who have helped participate. I will say I told the students 12:20 because they are very busy, and so I didn't need them to hear our whole spiel. But I think we have Swapnika and Grace here, so Eric will probably be joining in just a moment. But maybe we can start, Swapnika and Grace, since you're here. If you wouldn't mind just introducing yourselves, sharing a little bit about your background, which program you're in within the MPH, and then and let's just start there. And then actually, if so, share your background, what MPH program you're in, and then how you've been involved with the social impact team. So Swapnika, if you don't mind kicking us off.
Hi everyone. I'm Swapnika. I'm a second year MPH student focusing on health policy and management. And I come from a background in clinical dentistry. I'm an international dentist from India. And my involvement with the social impact, where do I even start? Because I think I've been involved with the social impact team and their programs in so many different ways over the past year. I think my first exposure was through the Medicaid Innovation Competition, where our team developed an idea addressing like food insecurity for the Medicaid population, and we were placed second. And yeah, I really enjoyed that experience because I think as public health students, it encouraged us to like think beyond problems from like the policy research lens, and it also helped us consider the business and implementation side and like pitching these ideas. And I also worked as a summer associate for my practicum with the team. I worked with Kelly, Fred, and Claudia on like several projects. And I think I developed a lot of skills in like stakeholder engagement, we managing multiple projects, and also like event planning that I haven't done before for the unconference. And this year I'm a part of the Impact Innovators program, where I'm leading a project called the Oral Health Equity Lab. And our team is designing community centered like oral health prevention and like education strategies to help underserved populations, better prevent disease and like navigate oral health care. Yeah, so a lot of ways that I've been connected with the social impact team. Great space where I was able to like experiment with my ideas and like work with community partners, and a lot of practical skills that I developed. Great complement, like powerful complement to like classroom learning for me. Yeah.
And we are so fortunate to have gotten to work with Swapnika. It's been just such a joy. Thank you so much, Swapnika. Eric, we got started just a couple minutes ago, but we were just having you guys introduce yourselves, say which program you're in, and then how you've been involved with the social impact team. So Grace, maybe you could go next.
Hello, everyone, it's so nice to meet you. My name is Grace Brown, and I am a second year MPH student in the Health and Social Behavior concentration. I've been working as one of the student associates with the social impact team since my first semester. So this is my fourth semester with the team. And it's been an incredible experience. Like Swapnika said, when she was working with the team over the summer, it's really great for building your project management skills, and building relationships both within the School of Public Health, other parts of campus, and even outside of Berkeley. So it's been really great for expanding my network and just learning about what is actually happening in the world of public health that you don't always hear about in the classroom. So it's been really great to see the full spectrum of what the team does through my job. But I think some of the opportunities that have been the most impactful for me are opportunities that also are available to any student within the School of Public Health. I attended the Social Impact Tuesdays that Kelly was describing. I did those my first semester. And even though I didn't apply for the grant funding, I just really loved hearing from all of these different experts about how they were working in the field of public health, and working on these innovative projects. And I feel like that was a really good orientation for me as I was coming back to school. And then I think you also heard about this hackathon, the Rural Health Hackathon that we're doing. And that's been a great opportunity to work with one of our impact fellows, as well as other students across the campus, and help them build those skills in policy development and pitching. So a lot of opportunities across the social impact portfolio, we can say, that we're really excited to offer.
Thank you so much, Grace. Again, we're so grateful to get to work with you and all that you bring to our team. Eric, do you want to go next and just introduce yourself, tell us about your program, and then how you've been involved with social impact programs?
Yeah, thank you for having me. Hi, everyone. My name is Eric Cortez Rangel. I use he, him pronouns. I am in my last semester of the online MPH program, so very close to graduation. I was actually a team member. I got involved through the social impact program as a team member last year. I was supporting a friend of mine that was leading a project for Central Valley students here in the Valley. For those of you not familiar with the Central Valley, it's the central part of California. And so we were leading a project for educational attainment in the Central Valley. This year, I decided to lead a project of my own, and our program name is Rubric. So we're building social infrastructure in rural communities that often lack public spaces to create connection, foster inclusion, and create sense of belonging, which is very necessary with the loneliness and social isolation epidemic. Um, I have experience in project management. I currently work as a director of program services for a local nonprofit here in the Valley. But I think that this program has really led me to rethink how I approach project management, working with diverse team members, diverse partnerships that need to be developed in order to move the project ahead. So I think it's allowed me to rethink how I approach my project management work here in the Central Valley, and also elevate it in some sense. So really appreciative of the opportunity to continue with the social impact team. And I'm so happy to be here, and glad that you guys are all joining to hear about our work.
Thank you so much, Eric. Yeah, I love that you were a team member last year. Now you're a team lead this year. I think that's so cool. And also, I know we recently were talking about how you got the idea for this sort of pop-up social infrastructure, pop-up parks. And you shared that that was actually in one of our one-unit Changemaker courses. Could you just say a little bit more about that? Because I think that's really interesting too.
Yeah, so I had the opportunity to take a human-centered design course last summer. It wasn't the 1 unit class, it was a 3 unit class, but the professor does offer a 1 unit class, the Changemaker course. And the proposal that I submitted for the Impact Innovators funding was actually the assignment that I submitted for the coursework. So I got the opportunity to work on that assignment and had that idea of creating social infrastructure. The community that I live in doesn't have any parks. We don't have any green spaces. And so oftentimes the closest park is about 30 minutes. And so that poses obviously a different health implications for many reasons. But I think this is a reality that a lot of rural communities experience and unfortunately live. So I think that lived experience led me to develop that project. And I was very fortunate that, had the opportunity to implement the assignment that I created in my own community.
Yeah, super cool connection. Love that you shared that. And the human-centered design course is really positive. In Social Impact Tuesdays, we might have one workshop on human-centered design, but that's often just kind of scratching the surface, just giving you a taste, but then you can dive in deeper in some of these other Changemaker courses or other courses. So you can do a whole course on human-centered design as Eric did, which can be really interesting. And I know you guys have all now touched on, it sounds like project management, building your network, community partnerships, are themes I'm hearing of some of the professional skills you've been able to develop working in our programs. But I'd love to just hear a little bit more about how you think these programs have helped you for your professional journey. I know we're all, most of us are really interested in using the either MPH or DRPH or doctoral programs to advance our public health career journeys. And so we really try to make our programming very practical skills oriented, as well as developing, I would honestly call all of our programs leadership programs. And there are things you can put on your resume. There are things you can talk about in interviews. You'll develop work samples you can submit to potential employers, things like that. But I'll stop talking because I think it's more interesting to hear from our students on how that's actually played out for them in real life. So yeah, maybe Swapnika, if you can kick us off again.
Yeah, a lot of skills for sure. I think one of the most useful ones for me has been like pitching ourselves like through the competition. And also I think even when we were doing a lot of interviews for like some of the projects that I was working on over the summer, I think there was a lot of like, how succinct can you be, how direct can you be, and like how can you actually pitch yourself well. And I think even the Social Impact Tuesdays, we had like a whole session on pitching. I think that was like super helpful. I think that's one of the biggest ones. Like I think that's been useful for me like with other interviews as well. And now that I'm working on this Oral Health Equity Lab. I think that's been a huge part of like talking to community partners and like, pitching ourselves and like within less than a minute. And that's been super helpful, I guess. Yeah.
Thank you, Swapnika. Yeah, Grace.
Sure. The thing that comes up for me is networking. I am naturally very introverted, and sometimes the idea of walking into a reception of people and just starting conversations terrifies me. But I think with the social impact programs, there are a lot of opportunities to network with other students or network with people who are working in public health. And just attending those over and over again has really helped me, I guess, also form my own personal pitch, like what Swapnika was saying, tell them about myself, and also help me develop those conversational skills that will help me hopefully find a job one day and make connections that will help with my work in public health. And some of those opportunities are one-off opportunities where maybe you're attending just one event, or it could be more involved, like like managing your own grant program, where you're repeatedly talking to community members. So I think that's been really good for me.
Yeah, thanks for calling that out, Grace. I similarly would absolutely characterize myself as an introvert, don't really like networking, don't seek it out, but have found ways for it to feel genuine and authentic to me, and to feel more approachable in whatever way that looks like. And we try to offer programming that gives a variety of opportunities for that. It's not always just like walking in a room with 100 people, right? That can be really intimidating and or just not the most effective. We do have those opportunities too, but we offer a lot of kind of different avenues for developing that real authentic connections with other folks in the field of public health. Yeah. So Eric, anything in particular you want to call out?
Yeah, I think I would take it back to the application process. That whole process in itself is very useful when in the real world you're applying for grants. As I mentioned before, I work as a project in project management, leading public health programs in the Valley. So we do a lot of grant writing, and I think that having that skill is very necessary, especially if you are to enter the nonprofit sector where it's a lot of grant writing. And I would encourage you all to just simply apply. I think you'll learn a lot about yourself through the application process, submitting a proposal, putting a budget together, looking for partnerships, and strengthening your application. That those are skills that you will have to use as a public health professional. So the earlier that you can start getting sharpening that skill and honing in on that strength of grant writing, the better.
Yeah, thank you for sharing that, Eric. And I always tell teams to the teams that aren't selected for the 10K in funding, it's not because they have bad ideas. In fact, they usually have wonderful ideas. It's usually just that they're not quite developed enough. But I think the actual process of developing the proposal is is important just in and of itself. And I'm really proud that most of the teams that don't receive funding keep working on their initiatives, which is really cool. And I'm obviously still here to support them, even if they don't have funding. Yeah, Claudia.
Hi, and I think this was mentioned by other folks, but we have a ton of fun with the work that we do and the organization. All our team, everybody's very open, very collaborative, and really we learn a ton. But I also just want to say that in this uncertain climate for finding a job, these additional skills around innovation, around project management, around like pitching your own idea, around networking are really important for you to prepare yourself for whatever comes next for you. So, in addition to being super fun and very rewarding, I also think this is really great training, that's beyond the classroom, but really prepares you to step into a role that you really love when you graduate.
Yeah, absolutely. Thank you so much for sharing that, Claudia. With that, maybe I'll turn it over to the students. So do you guys have any questions for our student panel? Feel free to put them in the chat or unmute yourself. Raise your hand and I'll call on you. And you can unmute yourself, whatever you feel most comfortable with. But yeah, as mentioned, we're super open. I'll give you guys a second. And maybe, oh yeah, Hakeem?
Yes.
Great to meet you. Yeah. Did you have a question for our student panel?
I didn't, but I can ask one actually. So I'm curious if any of you guys are in the dual program, any dual programs, um,
Oh, yeah, as in like the joint MBA MPH or MPP MPH?
or MSW. Yes.
Yeah. Oh, yeah, the MSW. That's really wonderful. Yeah, I'll let them answer.
I don't know about, I'll just say that we have a lot of dual students participating in all of the programs that we offer. And we're always looking also to enrich those connections. So I'm not sure if anyone's on the line for that, but I think people in those programs offer really unique perspectives, and make them really great, innovators in this space.
Yeah, totally. I can't agree more with that. That I think the dual degree students are really excited about our programs, and we're excited about the intersections between public health and these other parts of the university. And we really work with our colleagues at the other schools to help promote our events as well.
Yeah, I appreciate that. And the reason that I ask is that I am really curious about those intersections that you mentioned. I work with reentry, formerly incarcerated juveniles in Alameda. I'm the director of a program called Positive Youth Development, and I have
Mm,
16 youth that I work with. And I describe what they're experiencing in day-to-day life as a public health crisis. And when I go to the Capitol to do policy and I meet with legislators, that's how I frame it before I got into this program. So I am excited and curious to learn about what those intersections really look like and to learn the proper, language behind it. So yeah,
yeah.
that's why I was asking you. I was actually curious about that.
Yeah, I just would say we have an impact fellow. One of our impact fellows that I didn't mention is named Joseph Griffin, who runs a community violence program in Oakland, and has been a great addition. His project has really been setting up a training session in collaboration with the school itself of community violence interrupters. So that's been going on, and that's just been amazing work that he's been doing, and we've been super happy to have him as one of our impact fellows.
Oh, nice. Yeah. Okay, cool. Thank you.
Yeah, thank you so much for sharing. That sounds like really important, impactful work you're doing too. I think you'll find um, other dual students that are interested, as well as just students in the MPH, as well as students in the MSW. And I would really encourage you to think about applying for the 10K in funding too, for something in that area. I actually know our students on the panel are not dual students, but you will find many of them across campus.
Thank you.
Yeah. Okay, looks like Angelica has a question in the chat. I'm curious about human health and the built environment, specifically urban tree canopy. Do you work with community partners that work on urban greening in the Bay Area? Ooh, this is a really cool topic. Um, Fred, maybe do you know of any specific
Yeah.
community partners? Yeah.
Yeah, absolutely. There are a couple, and I'm struggling at the tip of my tongue to remember the name, but there are a couple of programs that work exactly in this area. And I do a survey that I send out to all of the community partners that we're connected with, which are many in the Bay Area. And we get then responses from them if they're interested in working with the students, say on their capstone project that all students have to do at the end of their second year, or many of the students, I should say, have to do. And I know we had at least one program, maybe two, that did respond to that survey. And thank you, Swapnika, who worked with me on creating that survey that we launched last year, who's on this line. So, and that group in particular, there is one class. There's a few different classes at the university, at the school, that do community projects where there actually is a partner organization that works with students. And I know in one of those classes, which was on needs assessment and planning, the Urban Canopy group that I can't remember the name of actually pitched their program to the students to take on as one of the clients. So we do have connections there for sure.
Yeah, and in general, as I'm sure you know, the environmental health program is super strong at Berkeley, and across campus. So it's really woven into the school, and I think you'd find lots of interested folks in this area. Yeah. Okay. So Cynthia's asking, where can we find more information about the course and the program? Your best bet is going to be socialimpact.berkeley.edu. This is where all of our programs live. And so you can find information there. And then we'll send lots of communications at the start of the fall about marketing, Social Impact Tuesdays, the Impact Innovators program. I'm actually going to be on maternity leave in the fall, but Grace has very amazingly stepped in as the interim program manager. So that is who you can look out for emails from in the fall. And then I'll be back also partway through this semester. So really excited to work with you all then.
Can I just add to that, Kelly? I also send out a regular communication roughly every 2 weeks about things that are going on, social impact that are going on both within our team, but more broadly, what's happening on campus, what's happening in the local community, what's happening nationally and state that you can listen into, et cetera. And as part of that, I will definitely be featuring the Social Impact Tuesdays course, which I'll be in Kelly's absence, also helping to co-lead this this next semester. So I'll be happy to share information about that. I can't remember, Kelly or Grace, if you know when we'll post the actual course to be courses.
It'll be in the course catalog this summer. Yeah, it
Okay.
should be in there soon. And then we'll have lots of announcements. And it doesn't start we give you a little bit of time as you're working out your schedule. So it usually starts in like the second week of classes or so. Cool. And then on the question for projects limited to the Bay Area, no, they can be anywhere in the US. We actually have a team, another OOMF, which is an online MPH student in the program this year who's located in Georgia, who's also in a rural area in Georgia and working on a project there, which is really great. Okay, other questions? Maybe we just have just a couple minutes left, but I would love to hear from our student panel. Now, since you guys are all in your sort of nearing the end of your MPH time, what advice would you go back and give yourselves at the beginning of the program, if you could, or as these students as they're about to embark on this journey? Swapnika or Grace, you go for it.
I think something I would tell myself, or something I had started doing earlier, is take advantage of the opportunities that you see, but also be very strategic about how you spend your time. There are so many things that you can do, and especially if I imagine several of you are also working while you're in the MPH, it can just be tough to manage. And so if you just have like some North Star of what your goal or goals are for being in the MPH, that can help you decide how you want to prioritize those extracurriculars. I think that's really helpful.
Great advice. Yeah, Swapnika?
Yeah, I absolutely agree with Grace on that. Another thing is, I think I've been trying to do that myself too, is just being more open and not putting myself in a box, like with job opportunities or internships, especially with a practicum, and also just like any other opportunities. I think I was always in my comfort zone of, sticking to my clinical background. But then with this program, I think I've pushed myself and like tried a lot of different things. And I think that was great, lot of transferable skills that I've been like learning. So I think that would be my biggest advice, is to just like be open and try everything when you're in the safety net.
I love that. Yeah. And I always say our programs are a low risk way to try things, right? It's not a full-time job. So it's a really good way to test things out. You're like, oh, I've never done something that's more sort of entrepreneurship focused. Like, let me try this, see if I like it, see who I meet. Yeah, and it can be a low risk way to do that. Eric, how about you?
Yeah, I'd say networking. I feel like that's huge, not only with professors, but with community partners. I think I've been pushed a little bit out of my comfort zone, especially through the funding that we're having to launch our program, where now Kelly knows about this, but we set up a meeting to discuss our project with the design firm. And I think that the partnership of connecting health to how something is designed opens doors for collaboration, for open conversation, and then who knows, for jobs down the line. So I think that network with professors, with community partners, and simply, even if you just reach out to them and say, hey, can I do like an informational interview for 20 minutes to explore what is it that you do in your career? Because it's something that I'm curious about. Oftentimes they'll say yes because they're happy to, feed that curiosity and engage you to continue down the path of public health.
Such great advice. We just have a few minutes left, so maybe with that we can just give a big round of applause, virtual applause for our student panel and for their sharing and just truly, I'm just so grateful for everything you brought to our programs in school. And we can't wait to meet the next class of MPH students who will be in Swapnika, Grace, and Eric's shoes before we know it. So thank you guys so much. We have just a couple minutes left if anyone has other questions for our team. I'm going to go ahead and unspotlight our students, and you guys can feel free to head out, but we're so grateful to you for joining us today. So other students, feel free to stay on if you have other questions for the team. We're happy to chat. Thank you guys so much for joining. All right. And we'll also publish the recording for this session too. Looks like most folks are hopping off. Ruth or Liliana, did you guys have any specific questions to the team that you wanted to ask directly?
No, thank you.
Yeah, thanks for joining. Okay, I'm gonna go ahead and end the recording. Thanks all. Thanks, Grace. Thanks, Swapnika. Really appreciate it.
Thank you.
Bye, guys.
Thank you.
Thanks, Eric. Talk soon.